Usapang kalusugan sa Health Check Plus. Alamin ang mga payong medikal mula sa mga totoong eksperto. Ang kaalaman ay kapangyarihan. Usapang kalusugan sa Health Check Plus.
Nagbabalik po ang Health Check Plus. Kasama po natin ngayon si Dr. Hannah Bernardino. Siya po ang namumuno sa Health and Wellness Center ng St. Luke's Medical Center sa Global City, Taguig. Magandang araw, Dok Hannah. Kamusta po kayo?
Magandang araw, Attorney Mimi. Salamat po sa pag-imbita sa akin dito. I'm doing very well. Thank you for having me here. I'm very excited to be here today.
Sobrang saya po namin na you're doing very well. Pero alam niyo po, Dok, ang dami-dami po nating mga frontliners, lalo na at mga kababayan po na sobrang stress sa panahon ngayon. At sure po kami na yung mga frontliners po yung talagang super stress ngayon. Kayo po, doktor po kayo, paano po ba nagdi-distress ang mga frontliners, lalong-lalo na po dyan sa St. Luke's?
Yeah, that's a good question. There's a lot of ways to cope with stress. Iba-iba tayo, kada tao. Tao lang din po kami, mga doktor. Kaya napapagod din, na-overwhelm. Lahat ng pwedeng maramdaman ng isang tao, nararamdaman din namin. Pwede rin po kaming magkasakit. Ang maganda naman sa St. Luke's, where I'm from, is the administration gives utmost importance not just to patient safety and to our patients, but also to the staff. So meron namang pwede ma-avail ng mga services yung mga staff pag nahihirapan na. Kasi of course, sometimes we need to talk to somebody lang about how we're feeling, to what you call this, to debrief. Importante din po yun. You have to acknowledge how you're feeling, not just deny it. Hindi lang, dapat, kunyari, nalulungkot ka, pwede mong i-express na nalulungkot ka or nahihirapan ka. We have our families, a lot of us, then nagkakasakit, lalo ngayon with the Delta surge, kasi alam naman natin, mas nakakahawa yun kaysa sa yung mga naunang variants. Pero ang maganda din, na gusto kong sabihin, yung mga frontliners na nagkakasakit, dahil most of us nabakunahan na, so most of the COVID na, pag nagkaka-COVID, breakthrough infections, nagiging mild naman or asymptomatic. Kaya effective talaga yung vaccination sa severe COVID and death. Kaya I'm also encouraging everyone na magpabakuna na pag available na ito sa inyo, agad-agad. Huwag na tayong mamili kung ano yung gusto nating brand, kung ano yung meron, kasi it really will help prevent disease. So, I think, yeah, yun yung masasabi.
Yun po. Doc, ano po, doon po sa una po yung sinabi, sabi niyo ba, at very important po, sabi niyo, tao lang po kayo mga doktor. Pero meron po tayong nabanggit, kayo yung namumuno sa Health and Wellness Center ng isang ospital. Yung Health and Wellness Center po, ibig sabihin po, nagkikater po ba to both sa patients at saka sa doktor, o para lang po sa mga frontliners at employees po ng inyong ospital?
Hindi po. The Health and Wellness Center is where we have executive checkups, regular health screening. This is an ancillary service open sa lahat. Open na po lahat ng ancillary services ng St. Luke's kasi we have to learn to live with COVID, hindi porket pandemic ngayon, magsasara lahat. So, andito na tayo sa gitna, so mag-a-adjust tayo. But ang maganda is very safe, and we give utmost priority to safety. Kaya dito ginagawa yung mga health screening. We have a lot of clients, mga sila mag-avail ng regular health screening nila na we all need yearly, like yung mga blood tests, diagnostics like x-ray, ultrasound, stress test. Ang maganda dito sa amin, it's a one-stop shop. Everything is done in the center. Also, all patients are required to have a swab. Kasama po to sa package. We have our own swabbing center. So doon na po din ginagawa. It's all in the seventh floor of St. Luke's Global. So if you can check it out, nasa website naman po ng St. Luke's. I can assure everyone that it's very safe. And it's important to have your health screening that you need, kasi hindi natin pwede pabayaan yung health natin ngayon kahit may COVID, kasi we want to focus on prevention of disease. So kailangan mahuli ng maaga if you're at risk for anything. If you have history ng mga sakit like hypertension, diabetes, cancer in the family, or ikaw mismo, meron tayo parang mga regular screening na kailangan. So lahat to nagagawa doon lahat sa health center, sa wellness center namin.
Opo. Parang medyo meron pa po ako mga tanong po patungkol dun sa inyong health and wellness center sa inyong hospital sa St. Luke's. Pero bago po dun, isang tanong na lang po dun sa pag-distress at saka debrief ng mga frontliners na katulad niyo po, Dok Hannah. Ang tatanungin ko po, yung sabi niyo po yung hospital niyo kasi gives premium on the health ng hindi lang ng patients niyo pero sa mga frontliners. Para po sa inyo, ano po yung kumbaga, parang nakikita niyong very important na aspect ngayon na dapat rin, katulad ng hospital niyo, makita ng ibang hospital or ng public na bigyang halaga as regards yung health po ng mga frontliners, mga doktor, mga nurses, yun po, yung mga umiikot po, mga nagpupunta sa hospital or sa laboratory. Ano po sa tingin niyo yung kailangan bigyan natin ng pansin or bigyan ng budget, lalo na po ng hospital? Private or public man? Opo.
Okay, aside from safety, which I talked about already, yung mga protocols natin ng infection control, mental health and well-being is also important. So we have like services for the employees nga, kunyari, kailangan ng mental health professional, they can avail this. We have psychiatrists who can help us pag talagang kailangan na. The admin is very supportive din sa like giving mga frequent lectures on how to handle stress, how to cope, mga tips. So not just yung prevention ng COVID, but also the mental health, very important. So I think that's what we should also focus on that sa ibang mga hospital, the mental health of your frontliners.
Opo. Parang yun nga rin po yung sinasabi na hindi nakikita pero kailangan ng pagtaunan ng pansin. Pero nabanggit niyo po, Dok Hannah, kanina na yung effect po ng COVID sa inyong health and wellness center is for you to install safety protocols, and then yun i-require RT-PCR tests from your patients or yung mga clients po ninyo. Pero yung po natin, yung number of cases po natin ng COVID-19, pataas, mga baba, patataas. Tapos ngayong year po, nagkaroon po ng surge. Parang meron po mga araw na hindi tayo bumababa ng 20,000 cases. Ano po yung effect ng particular ng mga surge na ganito or ng surge na itong latest surge sa inyong center?
Yes, I think everybody is afraid of the surge. Lahat naman po tayo takot sa news na naririnig natin. It costs everybody to delay. I mean, not everybody, a lot of people to delay their health screening or executive check-up. So, ang nangyayari kasi, mas mababa talaga yung census namin compared to the years before. Pero I think a lot, ganun naman across the board, all over the world, mababa talaga yung mga businesses. Pero yung is, pag nade-delay yung mga health screening, sometimes may mga hindi nakikita na diseases that could have been prevented. Like, for example, basic fasting blood sugar, yung test for diabetes. May level kasi yan na impaired fasting. If it's above 100 milligrams per deciliter, nakikita yan sa blood. Hindi pa siya diabetes. Diabetes is 126. If it's in between that 100 to 125, impaired fasting yon. So that's the time na very important yung prevention, lifestyle, and exercise diet. So ito talaga ma-prevent pag nakita mo early. So you can make changes to your lifestyle, eat healthier, exercise, lose weight, kasi it's the most important thing talaga for not just diabetes but also hypertension. We have to check your blood pressure kasi resting blood pressure, dapat resting. So pag mataas na to, hindi pa naman yung sometimes kaya pa, I mean most of the time pag early pa kaya pa ng diet and lifestyle, kaya very important yung lifestyle. So other screening na kailangan, very important, like yearly mammograms for women above 40, yearly or biannual, para to detect early breast cancer is important. We offer also yung mga colonoscopy for colon cancer screening, kasi ang dami na rin cases ngayon eh. So dating recommendation is for everyone 50 years old and above. Ngayon, age 45 already. So if you're 45 years old, you might consider, especially kung may family history, getting a colonoscopy, which we also offer. It can be done every 5 to 10 years. But if my family history, it could be earlier than that. Kunyari, your father got colon cancer at 40, dapat at 30 nagpa-colono. 10 years before that, colonoscopy ka na. So there's a lot then. For smokers, may mga specific din na tests for lung cancer screening. So also, I didn't mention kanina yung cholesterol levels, lipid profile. This can also prevent ischemic heart disease, which is the #1 cause of death pa rin worldwide, according to WHO. So, ayun, hypertension yon, and also your cholesterol levels. So, if we know this early, we can prevent it through lifestyle.
Medyo, so ang dami-dami pong natatakot na tao dahil sa mga surge na pumunta po sa ospital. Pero sabi niyo po, meron po kayong enumerate, baka po pwede natin, especially for yung mga, mga comorbidities po ba tawag doon, yun po yung term na naririnig ko ngayon. So, para po sa mga diabetic, kailangan po para to prevent, because prevention is better than cure, sabi niyo po, Dok Hannah, kailangan po sana na very regular ang kanilang test for blood sugar. Yun po yung sabi niya. And test also para po sa mayroong alta presyon, nagkakaroon ng alta presyon. So yung hypertensive, kailangan po ng test on hypertension and matesin yung kanilang cholesterol level. Tapos Doc, sabi niyo rin if you're for ilang taon po ba dapat regular yung colonoscopy, Doc Hannah?
45. Age
45 years old.
And you can do it every 5 to 10 years, depende kung ano yung result ng first mo na screening colonoscopy. So this is just marami pa pong iba na importante.
Yung mammography, Doc, para lang marinig nila kung kailan start yung regular dapat po na magpamammogram ang mga babae. 35 po? 40, okay. Nadadagdagan ko po. And also yung regular screening for lung cancer yun po. Doc, sabi niyo po kanina ang effect ng mga surge ay talagang bumababa po yung number of cases or clients po sa inyong center. Kaya ang tanong po siguro natin ngayon ay, meron po ba kayong online consultation po sa Health and Wellness Center ng St. Luke's?
Unfortunately, wala now because nga we do all the tests at one day. So when you come to the center, kukunan ka ng vital signs. This is after your negative RT-PCR test. So, which is part of the package. You get the nurse will take your vital signs, height and weight, yung body mass index, very important to see if you're obese. Kasi, di ba, obesity puts you at risk din for kaya kasama siya sa COVID na, priority sa A3 kasi obesity can really predispose you to severe COVID. So after that, they will be seen by a wellness doctor like me. I-interviewin namin sila, the history, family history, yung mga personal and social history, and then we have to take a physical examination. Kasi kailangan din, pwede naman some things can be done online, but kasi yun nga, maganda makita ng doctor physically yung patient. After that, they will be taken to the lab it's in the same floor. Yung blood tests can be done. After that, yung x-ray, ultrasound, and then stress test. Hindi naman po pwedeng online yung mga tests na yon. So, rather than going to the hospital or to the other, isa-isahin mo yon. Pupunta ka sa pathology for the blood test, pupunta ka sa radiology for x-rays, and for ultrasound, iba rin yung pupuntahan mo. Hindi ka na kailangan umikot sa hospital. Andun na po lahat sa 7th floor. So everything is done there, and all the tests, I mean most of the tests, kasi yung mga iba naman, if you need an MRI, wala yun doon. Yung mga ibang level na, yung just the regular test that you need, like mga mammograms can be done there. We also have, we offer pap smears and transvaginal ultrasound, nutritional counseling as well, may din. So it has to be in person, pag ganyan.
Parang maganda po yung ginawa niyo po sa center niyo kasi kasi na-experience ko po yung online consultation, which is very convenient rin po at saka very safe. Syempre nasa bahay ako. Pero katulad po ng sabi niyo, if there's something wrong, talaga po magsasend po kasi ng referral letter yung doktor. Tapos pupunta ka pa rin on-site po to get your samples and your tests. So parang ganun yung ginawa sa inyo po, walang online consult sa health and wellness center. Pero one stop na lang. So nandun po siya buong araw. So yun po yung parang yung exposure or to an infection or possible infection po talagang mababa.
Yung mga kasama mo doon also are swabbed. So it's safe to go there. Kasi pupunta ka sa lab, hindi naman lahat doon ng pasyenteng pumapasok may swab, di ba? Or like the x-ray department. So it's really safer to go to our center. Yun naman after that, we make a summary with all the findings. We will write it down and this can be emailed na. Yung follow-up check-up, kasi after that, minsan, you don't understand yung kung ano yung mga results na lumabas, diba? Kasama po sa package yung pag-interpret ng results. We assign them to yung may mga on-deck na consultants natin. Yun po, pwede po yung online. Kasi pag-uusapan yun na lang yung mga results at kung may kailangan na gamot. Kasi nakita ka na So, nagawa na lahat ng test, nakita ka na. So, pag pinag-uusapan na lang ninyo para mas maintindihan mo yung mga results. So kasi it's important that you understand what you did with the diagnostics and all. So ayun po, pwede po yun online.
Opo. Doc, nabanggit niyo rin po kasi sabi niyo, pagdating po sa center niyo, ang pinakauna pong makakaharap po ng patient or ng client ay yung kayo po para po mayroon kayong wellness check. I'm sure po marami po kayong mga nakakaharap na mga kababayan natin who came from a work from home setup. So, kasi po dahil nga sa ating mga quarantines and yung mga safety protocol. So, nabibigyan niyo po sila ng advice. Meron po tayong mga nakikinig at nanonood na ganun din yung setup nila ngayon, naka-work from home. And they too are very stressed dahil doon sa setup na yun. Paano po kaya natin or advice niyo, paano natin sila matutulungan na ma-handle yung stress po nila na dulot ng work from home setup at saka yung mga lockdown ngayong pandemic?
Yes, kasi marami nga sa atin naka-work from home. We've also experienced, a lot of our patients work from home din, mga companies nila. So they tell us yung mga problem nila, yung sakit sa leeg, especially back pains, mga ganon, yung nakaupo ka lang the whole time in front of your computer. Also, like your boss or you get emails any time of the day, parang wala nang distinction yung workplace tsaka yung home. So it's very, very stressful talaga. Some of them nagkaka-insomnia. Some of them hindi na naka-exercise kasi yung mga dating nag-exercise kasi takot lumabas. So, some naman do home workouts which are good. But some hindi talaga nakaka-exercise kasi hindi nila feel. So, ang nangyayari, kasi we have patients who come back every year, we take note of their weight last year and their weight now. A lot of them, tumaas talaga yung timbang kasi nakaupo lang, nag-order lang ng pagkain, sa Foodpanda, Grab, ganyan. Papadeliver, sobrang convenient kasi ngayon, which is a good thing din. But minsan, kasi sa sobrang daming options, some people are stress eaters talaga, yun yung nagiging effect, nagigain ng weight, so nagkaka-hypertension, nagkaka-pre-diabetes, diabetes kasi lifestyle talaga itong mga sakit na to. So,
as much as possible, gumalaw rin po. And
yes,
yun po, lagyan ng parang meron pong timetable or everyday na schedule para hindi mag-check po ng email kahit padala ng padala yung boss.
Yes, sabi nga nila, sitting is the new smoking. So it's important to stand up and move around. Ang minimum requirement naman to get the maximal benefit ng exercise is what we always tell our patients, 150 minutes a week of moderate intensity exercise. Ano to? Yung moderate intensity, ibig sabihin when you can talk but not sing. So kahit ano yon, jog in place, dance, or ano pa bang pwede? Basta yung galaw, kahit house chores, basta hiningal ka ng konti, ibuhat ka ng mabigat. Weight
Weightlifting,
training.
opo. Weight training, opo.
150 of moderate intensity. So you can stretch that out kung hindi ka pwede nang dire-diretso. Pwedeng 10 minutes in the morning, 10 minutes sa hapon, tapos say space out mo. Basta makakomplete ka ng at least 150. Pag,
Per week.
ano naman, pag vigorous exercise, it's 75 minutes. So, mas short. Kung kaya mo yung mga high intensity, yung talagang hingal ka na. You can talk or sing. Yun yung high intensity kung kaya mo. 75 minutes lang kailangan. But again, of course, more is better. But if you can't complete it, some exercise is better than none at all. So kahit ano, kung may mga may sakit naman like hindi kayang tumakbo, kahit stretching, okay na yon, or kahit anong movement is beneficial to the body.
So, Dok Hannah, bago po tayo magsara ng ating interview, baka po mayroon kayong mga self-care tips na simulan nyo na po na maaari po ninyong ipamahagi sa ating mga tagapakinig at nanonood.
Okay, meron akong gusto i-discuss na self-care tips kasi merong 7 pillars of self-care. Galing ito sa International Self-Care Foundation. If we can just search it, isfglobal.org. So let me just run down the 7 pillars of healthcare quickly for your information. Number 1, knowledge and health literacy. Dapat alam natin yung mga tamang health screening na importante kasi it always starts with ourselves. So dapat alam mo yung health status mo, yung weight mo, yung blood pressure, yung mga basic labs like fasting blood sugar, cholesterol levels, ganyan. Number 2, mental well-being. Like we talked about kanina, it's important to talk to your friends or kung kailangan mo na ng professional help, it's okay. It's okay to admit that you're not okay. Number 3, physical activity. Exercise, very important. Like I said kanina. Meron lang akong gusto i-mention, merong study sa British Journal of Sports Medicine. May 48,000 something participants sila and it concluded that physical inactivity is associated with higher risk for severe COVID outcomes. So, yun nga, you have to exercise kasi it will really help you then prevent COVID. Number 4, healthy eating. Ito yung nutrition. We have to focus more on plant-based whole food, less processed food. Kasi nga, problema ngayon, stress eaters ngayon. So, dapat careful tayo sa kakainin natin. Piliin natin yung at least mas healthy, mas less processed. Number 4, risk avoidance. Yung pag-iingat, bawasan yung smoking, drinking. Dito kasama yung vaccination status kasi risk avoidance nga. So, hindi lang COVID na vaccine yung merong annual na flu vaccine that we need to prevent yung flu na that can predispose you naman to COVID. Tapos yung pneumonia vaccine din. Aside from others, marami pang iba. Number 6, good hygiene. We know this na, hand washing, disinfection. Ayun yung maganda din sa pandemic. Na-practice na natin yung tamang paghugas ng kamay, at least 20 seconds. You can sing happy birthday or twinkle twinkle little star or ABCD, ganyan. And the last is rational use of products and services. So yung mga pag-take ng maintenance na prescribed maintenance medications galing sa doctor ninyo or yung mga supplements. Kasama dito yung mga health and wellness services na pwede nyong i-avail, pagpapacheck up regularly. So yun nga. So again, number 1 is knowledge and health literacy. Number 2, mental well-being. Number 3, physical activity. Number 4, healthy eating. Number 5, risk avoidance. Number 6, good hygiene. And number 7, rational use of products and services. So if you want to know more, just search it online.
Maraming salamat, Dr. Hannah T. Bernardino. At diyan nagtatapos ang Health Check Plus. Pasko na po sa darating na linggo, kaya sa ngalan ng Health Check Plus at Vital PH Science Incorporated, ang aming executive producers, Virgilio Galvez at Edgar Zaragoza, ang aming graphics editor, Luna Lente, video editor, Poy Velas, ang aming accountant, POC Consultancy. Nagpapasalamat din po kami sa lahat ng mga doktor, fitness specialist at iba pang eksperto na aming nakasama dito sa programa. Marami ring salamat sa pamunuan ng Manila Broadcasting Company, lalong-lalo na kay Attorney Reggie Hularbar. Ako po si Attorney Mimi Campos Banayat. Tandaan, ating pangalagaan ang ating kalusugan sapagkat ang kalusugan ay ating kayamanan at huwag kalimutang batiin araw-araw ang ating mga minamahal. Be kind, be safe, and stay healthy. Ang Health Check Plus ay produksyon ng Vital PH Science Incorporated kasama ang Manila Broadcasting Company.